Yes. All right. And of course, any of the advice I give here is not a medical advice to be taken. You still have to talk to your doctor and your medical provider if you ever want to institute any of these tips.
Yes. So thank you so much, Dr. Kovitz, for being here today. We've had you in the past and we love having you because we know that a lot of people are always very interested in learning more about cosmetology and how to look young and beautiful. So thank you for being with us. And I'm just leave you to your presentation.
Great. I know you weren't recording before, so I'll kind of repeat a little bit of what I'm going to talk about. So I am the director for cosmetic dermatology, so I focus primarily on cosmetic dermatology. However, I do have some ideas about some of the newer trends. There's a lot of stuff on social media. I keep hearing anti-aging and aging, rejuvenation, all that stuff. I can't promise to be exhaustive on all of those topics, but I will tell you, and this talk may change in the year when we add stuff, but I will tell you my perspective on some of this stuff, and maybe we'll reinforce some things that you already know. Maybe we'll introduce some new things that you may not know, and then just at least help some people to get started to think about it. And some basic stuff is always good. And I tell my patients, I will talk a lot about things, and then I'll repeat myself a lot. And every time you come back to see me, we'll reinforce these things and keep adding new things. And if something's not clear, we'll start at the basics. So here we go. We are located at in Elmsford, New York, across Tappan Zee Bridge or Merrick Lumber Bridge. We're at Montefiore Einstein Advanced Care. We offer lots of different services. We actually are a multi-specialty clinic. I'm the cosmetic dermatology director there. I also offer medical treatments. We do have a medical dermatologist there as well. So the overview of the talk is that I will talk about some blue zones in the world where people actually are living healthy and longer. I don't know if you know about these, but there's a Netflix original series about this. And it got me thinking, what can we do to gather information from these people who kind of know what they're doing, I guess. They're healthy habits, and we will reinforce what we already know. We'll hone in on some of the tips for diet, physical health, mental health, and overall health, which you already know, but there's a lot of stuff, information and misinformation about out there. And so it's good to kind of round things out and kind of focus on some things that I think are important. And some skincare basics, of course. Maybe we'll touch a little bit about menopause. And again, I'm not an endocrinologist, gynecologist, or nutritionist, but I will give you my perspective. And then it's a good place to start, maybe to think about where you might want to discuss those things with your specialist in an office setting. And we'll talk a little bit about cosmetic procedures, where to start. This is not going to be exhaustive, but this is for people who are just wondering what it is that they can do for themselves. And then we can have a discussion. So I thought this was interesting that apparently the Danish twin study established that about only 20% of how long the average person lives is dictated by genes. The other 80% is influenced by lifestyle and environment. So nature versus nurture kind of discussion we've always had. And this was said by Dan Buettner, who is the founder of the concept of blue zones. And we'll come back to the slide in a second, but what are blue zones? These are zones or regions where a higher than usual number of people live much longer than average. So we have one in the United States, it's the Loma Linda. There's one in Costa Rica, and Italy, Sardinia. Greece is Ikaria, and Japan is Okinawa. There are 5 blue zones in the world. People are living over 100, but also they're happy and healthy. Their anti-inflammation habits are reflected in their healthy diet, stress management, social network and support systems, and physical exercise. So interestingly, the Power 9 is the 9 healthy lifestyles habits shared by people who live the longest they recommend moving naturally. So don't kill yourself at the gym. If you want to, you can, but literally walking, gardening, kneading bread. These people were just staying active, walking up a hill to church, every day, things like that. Knowing your purpose, being centered and knowing your goal, downshifting, so meditating and being, present in the moment. The 80% rule, don't keep eating after you're 80% full. Also eating plants, that's important. And beans were a big portion to their lifestyle, to many of these people. Wine at 5, so not to be an alcoholic or anything like that, but definitely these people consumed alcohol and when moderation was healthy for them. They also put family first. They also belonged to a social or religious organization, and they were part of the right tribe. They were surrounded by people who had the right or the same mindset as them and help them move along. So we'll kind of touch a little bit about this, keep kind of coming back to this and seeing what we can learn from these people. So of course, diet is big. And again, I'm not a nutritionist, but I think there are certain things that affects our lives every day, and we are what we eat. The American diet is killing us with obesity and other ways with processed foods, preservatives, and sugars, especially sugars. And then you have the fat and the sugar substitutes, which are even probably as bad. So when people say, keep hearing eat fruits and vegetables and a well-balanced diet, what does that mean? So the reason we want you to eat fruits and vegetables, not like just drink fruit juice, is because there's fiber in a lot of these alive foods. Fiber is essential for many reasons, but it dampens the glucose spike. We know there's a book called The Glucose Revolution. There's an audiobook, you can listen to it. Talks about how damaging sugar is and how it's everywhere in our diets. But that chronic spike in glucose is what ages us internally and damages us internally. And of course, then you want to incorporate a balanced diet with proteins and fats and sugars, but kind of like take that the nutritional pyramid and turn it upside down. Less grains, less carbs, but more of a nice balance of each. And you, of course, talk to your nutritionist for additional details. But anti-inflammation diet does have good fats. So I prefer personally not to go with the low fats because they start adding sugars and other things like that to those. Anything that's processed, just be wary of it. Omega-3s are great. So the Mediterranean diet has the olive oil. So it's anti-inflammatory, full of antioxidants. And they even are saying, now I was listening to a webinar saying how adding acidity like lemon and balsamic vinegar to your food may dampen some of that glycation, which is that damaging sugary process that kind of damages your cells. And that's kind of like the Mediterranean salad, right? You got the olive oil and you have the either, some kind of acid in there. So even alcohol in moderation and caffeine are recommended. Now, probiotics, prebiotics, and fiber are kind of linked. You can either take them by pills or ingest them with certain foods. A lot of fermented foods have probiotics in them. And fiber is a prebiotic, so it can be found in cruciferous vegetables like Brussels sprouts, broccoli. So broccoli, there's a reason broccoli is recommended. It not only has fiber, but it also has, antioxidants and things like that. Beans have, a lot of fiber in them. Also have, are nutritious as well with protein. You have to feed your gut microbiome. The gut is our second brain, and it actually produces something like about 80% of our serotonin. That's the hormone that makes us happy. And it also filters all the bad stuff through our immune system. So we definitely have to take care of our gut if we want to keep living healthy and aging gracefully. And an interesting thing, I've been more interested in intermittent fasting personally recently, just because it involves autophagy. Autophagy is another key term. And in layman terms, it's just basically a body clearing up bad stuff while we're not breaking down food. So that's why we want to take a break between meals. That doesn't mean you have to have coffee with sugar in it. That still counts as a meal or as sugar being broken down by the body. Autophagy is important. Clears out skin, cancers in our body, inflammation, pathogens. And there's many other ways in which to stimulate autophagy. Intermittent fasting may not be for everybody, especially if somebody's like a brittle diabetic or has other health concerns, and that should be discussed with your primary care provider. But it is important to start thinking about it. There's a reason we call it breakfast. So we break our fast from when the last time we ate at dinner, and there's a reason people say don't eat dinner too late. So there's something to it. And again, something to think about. And other ways to stimulate autophagy is hot and cold baths and moderate amount of exercise and other ways in which the body can start to clear out some of the stress induced damage that and pollution and things like that and toxins we put on our body. So I think it's an interesting concept and definitely can affect aging long term as well. And there's also evidence that there's less calories per day increases longevity. So again, going back to that centenarian rule of eating until you're 80% full and stopping, I am definitely guilty of doing more than that. And this is not judgment at all. This is something to think about, food for thought. And, you can read more about it on different audiobooks and learn more about it, what fits you and your lifestyle. Physical health, of course, is also very important. It increases endorphins. You get better mood, decreases risk for Alzheimer's, revs up metabolism, revs up the immune system, improves posture, and strengthens our bones because we lose, osteoporosis is real as we get aged. And natural exercise, going back to the centenarians, walking, gardening, sports, kneading bread, maybe doing something that you like doing, but doing it throughout the day and doing more walking rather than taking a car somewhere. So that I heard this also in some other webinar as a TED Talk, I think, the triple threat to Alzheimer's was walking with friends. You're exercising, you have the social interaction, which it keeps you connected, and you have the mind stimulation. So it is really important to be physically healthy. We are all kind of hearing about those things. It's kind of like the common things to say, oh yeah, physically, mentally healthy, but why? And these are some things just to remind you why. Mental health, and these are all, of course, connected. Mental and physical health, all connected. So technology can both help and hurt our brain function. Brains can become complacent, and we, start to not memorize things anymore. I remember my phone number, my cell phone number, and my home number, and I don't remember if I remember anybody else's phone number nowadays. But back in the day, we had to dial that phone and remember people's phone numbers. Another interesting thing is, ironically, more loneliness and social isolation is happening even in this world of technological connection. And on average, there is increased risk of death with people who are more lonely. This has been studied. So mental health is important. You want to reduce stress. These centenarians, of course, had faced stress just like anybody else, but they dealt with it maybe differently. Try meditation. You want to know your purpose. Find your purpose in life. Socializing, social, religious community groups, marathons, and connect with people. Sleeping is really important for mental health and physical health. This is when your body is regenerating, your mind and body. And of course, exercise is good for mental health. So this is how it's all connected. And you might want to just do a lot of walking, and especially walking after. They've actually shown too, after eating, walking after eating can dampen your glucose spikes. And again, this is going back to decreasing our chronic stimulation of our body with sugars and everywhere from all different foods that we consume. So in addition to fiber, just walking after just any meals can dampen the glucose spikes. And of course, general health. If you haven't seen a doctor in a while, check up with your PCP with labs. Of course, blood pressure, cholesterol is important. And then diabetes and prediabetes, and check your hemoglobin A1C. Just because you don't have diabetes, it doesn't mean that somebody may not have prediabetes. And this glycation process again, and this inflammation, this is just process of which our cells internally get toasted by sugars and inflammation. And we don't want to be at the point of already being diabetic. So signs like diabetic obviously is already bad, but pre-diabetic could be signs of pigmentation in our skin folds, in our armpits, in our neck. And that could be signs of insulin resistance even before somebody is diabetic. Of course, if you're also experiencing other findings like fatigue and hair loss, check your thyroid, vitamin D, and anemia labs as well. And that would be a good place to start. So what about skincare and procedures? This is kind of where I come in, and we start opening discussion during our clinics, what we can do to help people kind of jumpstart either rejuvenation or treatment of some of their concerns. Is it too early for anti-aging? Never. Is it too late? Never. And you can always start somewhere. Cosmetic anti-aging can be overwhelming, and it's understandable. It feels like everybody's doing it. Social media is way too much information about it. So people are looking scary. Like some of these stars are looking amazing. How are they staying so young? They're not injecting olive oil. They're probably eating olive oil, but they're not injecting olive oil into their skin. And then there's also a question or a fear of, will I look fake? Will I be forced to do cosmetic surgery? And I'm not a plastic surgeon, so I don't even recommend plastic surgery to a lot of my patients. But when it's needed, there may be a time where plastic surgery is needed, but my goal is to try to see what we can do now to maybe try to prevent that going in that direction. And genetics, of course, can play a role in that. And then, of course, menopause, there's some things that we can't always change, or, our age and hormones, but maybe we can impact it. And the more and more stuff is being developed and technology is moving forward, with how we can rejuvenate our bodies from the inside out. So it's never too early or too late to start wearing sunscreen. Of course, don't put it on a 3-month-old baby and put them out in the sun. But when you're out and about and wearing sunscreen, hats, and things, shades, a smart skin protection is important. Retinoids, and there's going to be a slide on that too. Over the counter or prescription, start somewhere. I had a patient who came in and she was using chronic retinoids for her acne on her face. And her face looked like she was at least 10 years younger than her age. And her neck, which she never put retinoids on there, looked definitely at least 10 years older, or at least there was definitely a discrepancy there. So that was a testament to how much retinoids over time can make a difference in somebody's skin and anti-aging. You also want to start antioxidants like topical vitamin C creams, which fight free radicals like pollution and UV damage. And there's different brands out there. It's not a discussion for this today, but just find a company that's reputable, a company that you trust, something that's not irritating. And that's something that's a struggle for everybody, finding the right price tag and also something that's efficacious and not something like it's $10 on Amazon. So there is definitely the process there, and it's not easy. Nobody says, oh, it's just so easy to pick a skincare for you. No, it's not. It takes trial and error. Reduce sugars. We talked about this again, but we don't want to be toasting our bodies from within. So try to see where your sugars are coming. Is it from drinks? Is it from certain foods? Processed foods will more likely than not have sugars in them just to make them taste better. And also things that are supposed to be healthy for you, like gluten-free things. A lot of times they'll put more sugar to make them taste better if they take stuff out. So fat-free things and lactose-free things sometimes can find more sugars in them. Be an educated consumer. Just like with sunscreen, you turn around and look at the ingredients in sunscreen, turn around and look at the ingredients in your foods and see what the concept or the grams, that's where your nutritionist comes in, how many grams per day, what you should be doing with that. Going back to where can we start? I definitely feel like we are born with the same number of hair follicles. Somebody just recently said that we start off as a baby, so we don't want to lose them. So we're losing, if there's alopecia, there's some kind of hair loss, address it sooner than later before it becomes too late. I'm not saying every alopecia can be treated 100%, but it is something to address, especially when something could be done about it. So get an appointment with or consultation with a cosmetic dermatologist to get a head start. And preventative cosmetic procedures should not be a taboo. Not everyone is doing them, but people who are doing them are looking natural, and you can't even tell sometimes they're doing it. They're just looking better. And so it doesn't mean that somebody will look fake or unnatural. And it's something that you could be discussing, even if you think it's priced for close, if you think it's going to be too expensive or not doable, there's no reason not to discuss it and find the best treatment plan for you with your dermatologist. So the basics of skincare, of course, there's lots of different things you could do for your skincare. One thing you definitely want to switch over if you can is to use a mineral SPF. I like zinc oxide and titanium dioxide, and one that is kind of easier to use. So if you could use one that feels good on your skin and doesn't have white shade and white tint, it's a little bit of a trial and error, and that's something we go through with our patients in the office. And I ask them to bring their products in. I can make some recommendations. We can trial and error. Don't forget to use sunscreen inside. It's a misnomer. When you say sunscreen, you think it's from the sun. No, you want to protect yourself not only from the sun, but also from visible light. This is especially important in skin color patients. Computer screens, overhead lights, tablets, phones all have blue light and other things like that that can age us and worsen pigmentation. And so people say, I only wear sunscreen when I'm outside. Please try to see if you can find one that has a moisturizer with SPF that's easy to use, doesn't feel burdensome, but include it as part of your daily routine. Also use fragrance-free products for those people with sensitive skin, acne, or rosacea-prone skin. Fragrance-free over time is going to be healthier for your skin. Retinoids, anti-aging, start early. Antioxidants we talked about. There's a slew of antioxidants out there. Niacinamide is one easier one to look for. Squalene, lots of other ones out there that I can't even pronounce. Don't get overwhelmed. I get overwhelmed with these products all the time. You start somewhere and you start researching, and you hear, you look at studies, you look at some reputable companies. And so that's going to take time, but you can find a vitamin C serum or cream that can suit you. And also the skin microbiome is important, just like the gut microbiome is important with our diets. We can maintain our skin microbiome by having a gentle skincare with ceramides. I like ceramides a lot. That's why I like CeraVe and La Roche-Posay products a lot. They're over the counter. They're readily available most of the time, and they replenish the skin with certain things that it may lack, or after cleansing the skin, and the skin barrier gets maintained. And in terms of retinoids, the reason we like retinoids is just to let you know why we like retinoids is because we can use them in acne. They decrease the skin and shrink oil glands. For aging, it almost after a couple of weeks to a month, it exfoliates the top dead skin cell layer and it gives the skin a glow. Unless you're irritated, and we'll talk about how to manage common side effects of irritation with your dermatologist. But collagen building has definitely been proven one of the things with topical retinoids, and it's important to start kind of getting benefits from that, if anything. And it can brighten the skin, it can shrink pores. And so the downside is that it can give you some irritation and skin sensitivity. There's ways, for the most part, not for everybody, but for the most part, to mitigate those side effects. And also it can make you sensitive to the sun, so you definitely should wear sunscreen every day. Skincare do not use alcohol or harsh estrogens on the face. Sometimes people feel like it feels so good, I want to put alcohol on my face and it feels so clean, but then your face will either overproduce more oil, and then you're also damaging the skin barrier, which is not great for your skin. And then you can't tolerate things like retinoids or vitamin C's because your skin is damaged. And don't use chemical SPF with avobenzone and oxybenzone. I understand some people only find these ingredients they can tolerate on their skin because of the way the zinc could be white. It's not the end of the world. If that's something that you like and you're not having any irritation with it and no sensitivity, continue using it, especially if you bought just a recently expensive bottle of SPF that has avobenzone or oxybenzone. But do pay attention to it if you do have sensitive skin or if you're continuously having skin irritation. Try not to scrub or over exfoliate your face every day. Kind of similar to the first point. It just kind of makes the skin more rough and dull eventually. And it can irritate or damage the skin barrier as well. Don't get burned in the sun and don't smoke. This is an example of a patient who did not want any chemical peels, no lasers, nothing. She just has melasma, just pretty bad melasma, some acne scarring, and then a little bit of wrinkles around the mouth. So she just opted in for retinoid cream and lightening creams. You can see some irritation. This is what irritation can look like from retinol. It can get irritated and red and peely. This can be mitigated or controlled with a little bit of hydrocortisone and maybe decreased use of it. That's one of the reasons I included this picture here, is that it can irritate the skin, but it can also improve it, and we have to find that balance. So with regards to menopause, the struggle is real. And again, I'm not a GYN non-endocrinologist. I wish I did know, I was just talking to Sandra, I wish I did know more about this stuff and can help especially perimenopausal, menopausal women, how to deal with it, how to prevent some of the changes with menopause. But we do lose estrogen, and then we lose bone and fat over time. We lose muscle mass, and unfortunately, every year, 1% of collagen is lost per year. So we lose the skin elasticity and plumpness over time, in addition to the bone and fat that is kind of selectively depleted in certain parts of the face. We also can have hair thinning. We'll talk about that on the next slide. So hormonal replacement therapy in the right person may be helpful, and not every GYN or endocrinologist does that. And I think there's a lot of holistic sort of centers opening up now with all kinds of IV treatments and stuff like that. I would say take those with a grain of salt and just be careful, make sure they have the right credentials. And again, I don't know too much about it, but I do know that there's some professionals and specialists who do recommend hormone replacement therapy. And I think I trust those who are qualified to make these decisions. And of course, a healthy lifestyle will help. So if our mitochondria is exhausted by all the toxins and pollutions we put in our body, maybe by changing our lifestyle, we can actually help the cells regenerate and stay healthy longer. And so that will help with the menopause part of it somewhat. During menopause, we can experience hair loss, which can manifest as temporal and frontal thinning. So you can see the scalp, you can see the scalp a little bit more, and the hair is less coarse and more thin. We call that miniaturization of hair. And that is a version of it. So it's androgenetic alopecia. It's a female version, necessarily not the same thing as a male pattern balding, and has to do with hormones. Usually, in certain cosmeceuticals, I won't discuss them today. There's a whole slew of them, topical and oral. They can target DHT hormones. They're called DHT blockers. You've probably heard of them. And many also combat stressors. So like ashwagandha is known to help like combat stress and cortisol levels in the body. Sapo metal is supposed to be a DHT blocker, antioxidants, help really combat some of the stressors in the body. They can cause hair loss. There are many more, and many are probably don't have a lot of science behind them, but there are a few that do. I think the best studied medication topically for hair loss has been topical 5% minoxidil. We used to know it as Rogaine, and it comes in foam or solution, and it should be used chronically long term. So when you stick with it 3 to 6 months later to 12 months later, it does help increase blood supply to the scalp, and hair does start to grow. Side effects are irritation and shedding initially, and some people can get excess hair and other areas they don't want to get hair, which affects women a little bit more than men. So moving on to rejuvenating procedures, there's lots of options, and you don't have to do all of them. You don't have to do like PRP, fillers, Botox, and lasers, and then feel overwhelmed. Like you're like, where do I start? I feel like I'm behind. What do I do? So nowadays we are moving towards sort of more of a biostimulatory kind of the body, using our own bodies to heal ourselves. So I think a nice option for somebody would be to consider PRP, which is platelet-rich plasma. It is a concentrated growth factors. We get it from our blood and we spit it out. There's a special kit that's used. And we could use it for hair rejuvenation by injecting it. And we also started doing microneedling with PRP injections. The actual microneedling aspect of it also can stimulate scalp growth. And we can also use microneedling for the face with the PRP. So that's one way to stimulate collagen in the skin without feeling like you're going to be fake or lose yourself with this procedure. Of course, ablative and non-ablative lasers are an option in our office. That usually targets pigment, redness, wrinkles, sun damage, glow, pores, acne scars. And sometimes, rarely, it's, laxity here, especially if it's moderate to severe, it's hard to do anything besides like a plastic surgery, but there are some things, and if the patient is okay with not like significant results right away, there are some procedures we could do. In our office, we have broadband white, which is it's called BBL in our office. It's like an IPL, but in my opinion, it's a little bit safer and easier to use. And it is a non-ablative, almost no downtime laser, which we can use for pigment and redness. Halo laser is a hybrid laser that does have downtime, and you can get red and scabby, and needs like at least a week of downtime. And then you have the ProFractional, which is more ablative. We can turn it up or down depending on what we want to accomplish. And SoftWave is a newer version of ultrasound technology, which is coming to our office. And then we have Morpheus 8, which is RF microneedling. You might be hearing all these terms thrown around in social media or everywhere else. And we're always trying to keep our ear to the ground with their newest technologies, or maybe not the newest, but the most effective. And I think our office provides a nice variety of options, both ablative and ablative, not ablative, and invasive and non-invasive. For example, this patient had a combination of BBL and halo laser for pigment and reds, and you could see she didn't want to opt in for the most aggressive downtime. She was okay with not repeating the treatment again in the future. And you could see it's not perfect. The deep wrinkles, I think maybe you require maybe some filler, maybe another procedure. But overall, she's very happy with the results and is happy with her skin. It also helps some precancers as well. This patient did have a little bit more downtime and more scabbing, more swelling and kind of oozing around, especially around the eyes when we went stronger. I apologize for the different flashes here, but definitely you could see there's like the excess skin is gone here with moderate to severe ablation with the erbium laser that we use. Of course, don't forget to take care of those brown spots and skin tags because it kind of make the skin look older. So don't wait for all of them to accumulate and then you have to get them all at the same time. So if you start to see brown spots, back of the hands, and then more ones that stick out like skin tags and SKs on the neck and other areas on the face, you can consider taking those off with your cosmetic dermatologist. Now, the dreaded injectables, this is where people think that they're going to start looking like the Maleficent and, which with the big cheeks and starting to look with the big lips. And people should be afraid of getting procedures done by somebody who doesn't know what they're doing. But injectables in general are divided into two categories: is the neuromodulators, where you hear Botox and Dysport, and those usually kind of flatten out or at least smooth out the lines so they don't get deeper here. So the 11s here, the crow's feet, sometimes the down pull here. We want to kind of relax them so that we don't keep reinforcing those muscles, moving and then crinkling that skin. And so when people come in with a really deep line here, it's not too late. We definitely can start preventing it from getting deeper, and it will over time improve. But don't wait until it's super, super deep where you might need a filler actually, rather than just a neuromodulator to fill it in. Fillers are like Restylane, Juvederm. They are fillers. They are hyaluronic acid, and they go into the lines which are deep, which even if you put Dysport or Botox in, they smooth out, but not completely. They fill the space, but they also can help fill the bone and fat loss that we lose over time, and we can go deeper to reinforce that scaffolding, because if we lose the scaffolding, everything starts to sag. And so when people say, I want to fix this, but why are you injecting here? There's a reason. We need to reinforce here where we lose over time. So biostimulators are kind of having a comeback and are becoming more popular, just like PRP. We use our own body's capacity to stimulate collagen over time after something's injected, and that kind of dissolves over time. Sculptra, which is PLLA, is one of those biostimulators, which can be used in a more natural and gradual way to reinforce the scaffolding, but also has been proven to improve the brightness of the skin and the texture and the quality of the skin. It does require shots, requires some downtime with bruising and swelling, and then massaging for about 5 days after. Sometimes you need another treatment about 6 to 8 weeks afterwards. Radiesse is a filler similar to the other fillers, but it does also have biostimulatory effects over time. So, in general, prevention is easier than treatment. You can start small with just using SPF and retinoids right now, and then maybe an antioxidant. And then you might want to do something like a small, like a non-ablative BBL treatment or microneedling with PRP that doesn't have too much downtime. And treatment options are a little bit more invasive. You might want to discuss the downtime, the results, how many treatments you'll have, the prices, of course. And biostimulatory treatments are more natural, but also don't have that oomph where you see, like when you inject something right away with filler and you see the cheek go up. Biostimulatory treatments are more gradual, and that doesn't mean you can't do both. And a lot of times we do use both. And less invasive treatment technologies are coming up, and I think they're great for prevention plus treatment of mild to moderate cases. And like Softwave, for example, is a ultrasound device that has no downtime for all skin types. And that will be using a lot more on the whole face. There's some brow lift capabilities, and maybe some more on the jowls here. So I'm excited about this technology and what's to come in the future. But overall, going back to where we started, you definitely want to start a holistic approach. And it may feel overwhelming, but you can choose one thing from what we talked about today, and then maybe just decide to use less sugar or in your coffee today for the next couple of months. And that could be something that you decide to do for yourself. Healthier diet, stress management. You might want to take a walk with your friend after dinner. Maybe join a club to help you support yourself. Just because we have so many friends on Facebook and social media doesn't mean that people don't feel lonely. And I think having that personal connection, call a friend, I think is important. doing walking, pick up a sport that you enjoy. Start with basic skincare, and then consider rejuvenation procedures that the centenarians in the blue zones were not privy to, but they obviously are not from a different generation, but we have these technologies that are available to us that we can do something about. And it's not a crime to explore those options and discuss them with your cosmetic dermatologist. And so if you guys want to make an appointment specifically for cosmetic things, there's an email here. You could email at cosmetics@meadvancedcare.org, and there's a number here that is, you can leave a voicemail and it gets checked every 1 to 2 days. There are medical appointments are also available, which is the general call center number here. Thank you for your attention. I'm just gonna.
I have to say thank you, Dr. Kovitz, for all the information. It's really good. And at this point, I would like to invite our attendees. If you have any questions, please write them in the chat or the Q&A, and I'll be happy to read your questions to Dr. Kovitz. And in the meantime, while we start getting questions from our audience, I have a couple of follow-up questions too. Lately, I've been hearing a lot about the temperature of the products and that having something to do with how they work on your skin. And as a matter of fact, they even sell now like a fridge for your products because you want to keep them cold and all of that. How true is that?
I think that there's probably some truth to it. I honestly will say I don't know the exact temperature of what my products. I mean, if you have a very hot house or the temperature of your room where you keep your product varies and it's often gets hot, I think it does tell you the temperature at which your product should be kept. So the products that you buy, usually prescription ones especially. But I know I've heard about those little fridges you can keep next to you. I think those are useful if you have like an eye cream or an eye gel when you wake up in the morning and you're using it for anti-puffing. So it'd be nice to put that on right after, especially if there's like a cool metal applicator. Sometimes it's nice to apply it. I think it's not a bad idea to keep products at a cooler place because it probably extends their shelf life. And we don't know. I mean, a lot of these going back to the vitamin C and more higher end products, where there's a more, companies a little more reputable, they do those studies, right? They do, they say the shelf life of this product is this much, and at this temperature. So I hope that we want to trust these people and these companies. So whereas like if you, get a company that you've never heard about and it's newer, but I don't see any studies and they just put together some ingredients, and have they tested it on people? Have they tested how long it lasts on the shelf life? It's really, and that's where the struggle comes, I think, when you look for skincare. And I struggle with it myself, like I mentioned. There's a couple of, vitamin C companies that I probably will go there. I've tried a few here and there, but I feel like there's a paucity of science-based articles on a lot of these. And you just have to you have to kind of try some of these and maybe trust them because they've been around for a while, like like over-the-counter stuff like Neutrogena, La Roche-Posay. I think they've been around for a while, so I kind of put my trust in them. Not so much Neutrogena and La Roche-Posay, but I do like La Roche-Posay products a lot. I guess the answer is probably would be good for like anti-puffing. Creams in general would not be a bad idea, but if you don't have a fridge for your topical creams and your rooms are pretty cool, I think it probably would be okay.
Okay, thank you for that. What about those quartz rollers that are growing in popularity? Do you believe in them? And if so, how are you supposed to use them?
Yes, the gua sha method and the lymphatic drainage. Yeah, those are actually, I recently got one for myself because I was like, what is all this, fuss about? And I definitely feel like, I think that if you do anything, it's part of your routine every day, and you massage, you drain your face, do lymphatic drainage, just like a body massage would be good for you. You're moving all those toxins, increasing circulation to your face, and also probably improves penetration of some of the topicals you're doing. And as long as you're not overdoing it and really causing pressure and bruising on your face, I think it's a nice, healthy exercise to do on a daily basis. And I think will probably even help in the morning if somebody has puffiness around the eyes. I don't think there's any downsides to it, just except for like adding 5 to 10 minutes to your regimen. But if you can afford to do that for your self-care, all the power to you. And if it makes you feel good that you're doing something for your skincare, and again, those endorphins, that feeling good about what you're doing for yourself, I think that kind of adds to the kind of self-care. And I think that you could be using those products.
Now, when you go to Amazon and you put beauty products, you can see so many different things in there, and some are very costly, some are cheaper. And some of them that I've seen is like these lights, red light, blue light, green light.
I was thinking about actually mentioning that in maybe my skincare because the LED, I particularly like red LED light. There is evidence that it stimulates collagen, and in general, you keep hearing about this biohacking now. When people talk about biohacking the body or whatever, where like they have these like walls of red LED and infrared panels where either they can range from like little boxes or walls or even just face masks that you can put on your face. Again, same thing as with cheap skincare, cheap lights. Be very careful because a lot of these LED lights are not pure 1 or 2 wavelength. They're just like kind of just shining a light, and it's not studied. So you can be just causing more pigmentation on your face. Especially if they give off a lot of heat. Some of them will give off heat, but if it's a lot of heat, I would caution as well, because you're not trying to you can stimulate melasma and other pigmentary disorders with inappropriate LED lights. But I think they do actually have, I think Omnilux is one. There is one, and again, I don't have any connections with any of these. Omnilux is one that I know that I've used in the office before because we had an LED light, and then I bought their like face masks that's for the face and neck. And I was like, oh, let me just give this a try. So it is a mask that you put on. There's ones that you put on, and there's like one on the nose so it doesn't touch your face. I think they vary with the number of diodes and number of lamps they have in there. The colors, I find that the red is probably the best one if you want to kind of start off. Blue ones, beware if you have melasma or pigmentation issues. But I think there's just so many of them, and I think they're going to hopefully come out with better ones and more targeted ones, like ones for acne. I think the blue is for acne. But again, I think the red ones are the ones that I would go with. I wouldn't buy like a really cheap one off the internet. When I say cheap, I don't even know what that means. I would like maybe $20 one. I don't know. And again, it doesn't have to be like thousands of dollars, but some of them are. And people are like biohacking their whole house. They like have infrared light beds and all this kind of stuff. But I think it's not a bad idea to start with one of the masks. And I wish I wish I knew more information about out there, but I am using the Omnilux one. And whether it's because it's more advertised, but I definitely know that's a company that I've seen for years. And I tend to go for companies that have been around for a while. And just to add to it, actually, for example, for hair growth, a lot of lights therapies are out there as well. And I find that I tend to recommend Hair Max, MAX. They were one of the first ones to come out with a hair comb, which has LED, like the diode and LED lights in there. And those actually have been around for a while. So I feel like they've been around, they've done all the research, and hopefully they continue to do research, and they've come out with a cap. And now it's like the cap is like $1,000. I think the comb is anywhere between $300 to $400. I think the comb for me, I feel like would be more effective because you're moving it around rather than the cap's just sitting there.
Yeah, you're like massaging your scalp.
Yeah, and you're moving it around because the cap is just sitting there. So imagine like a layer of hair just kind of blocking it. So I think maybe the cheaper option is better. And if, again, within those companies, they have different versions. So maybe the newer updated version has like, it's stronger, maybe has more lamps in it. Again, I think I did like a part-time job trying to figure out what all the different technologies are out there. And then if you go to an office that offers to sell one of those caps to you, just because they found that it works they tend to be kind of expensive there too. doesn't mean you're going to go wrong with them. If it's available to you, you can use the more powerful ones. And I think that's where there's so many out there. I think Irish Store is one that used to be a Costco. I don't know if it's still there. Hair Max is the one that I recommend. And there's another one, I think Capulus, the hair cap. There's so many. And I think you have to, the reviews, reading reviews is hard because it could be like 1,000 people that liked it, but could they have just had hair growth anyway? Because this is not studied. So I would look for ones that have studies, and not a lot of them do. So it's very
And how do you look at that? How do you look at if a product has been studied or not?
maybe because I go to, so I when I like, work on talks and presentations and write review papers, we go to PubMed, which is it's a kind of an online library where scientific data is public, links to articles and reviews. And so I find my information from there, and then I work backwards. So the ones that I do find information on, and if they happen to mention the brand name in there, then I will often say, okay, well then to me that makes a connection. So this, for example, Hair Max, I can't really 100% say right now, but I would go back and see if they were studies that were done. And same thing with hair supplements, like for example, Nutrafol. Again, I don't have any stock with them or anything like that, but Nutrafol has studies for their supplements, and can a lot of other companies say that? I don't know, and I would have to do the research, and that's where it takes time. So it would be great to, I know that Nutrafol, then Viviscal used to be a pretty Lambda Pill were the three companies that had sort of mild to moderate scientific data. I know there's a newer one called coming out, Vegamore, that's coming out with oral cosmeceuticals. But again, I would have to see if they have any studies. That one is something that I would have to, they say that there's studies, but I would like to, you have to dig, and it's exhausting, and it's not readily available sometimes. But Nutrafol does. I think the Nutrafol, if we go on their website, they do have studies available you can just download.
And Dr. Kovets, are any of these treatments covered by insurance? Because I know that anything that is cosmetic, it's not covered. So are any covered?
I think that the office visit for an evaluation, for example, if it's rosacea or hair loss, or when we're prescribing it for medical condition like prescription topical retinoids, that the office visit is an evaluation by a medical provider that should go through insurance. Unfortunately, because these are not FDA approved treatments, they're not really covered at all. Even minoxidil, topical minoxidil, even though the Rogaine is covered FDA treatment, it's over the counter. So it's not even covered by, it's not like I can prescribe somebody topical minoxidil and they can go and pick it up at the pharmacy through their insurance. They are not. And so PRP injections into the scalp and all of that are not at a point where healthcare is being able to support our patients through this cosmetic journey at this time.
Yeah. And this will be, I think, the last and the hard question of the day. You showed some pictures, right? And you said some things, sometimes treatments don't go very well. And I agree with you. Some people look scary after some of the treatments. So why is that? Does it have to do with the individual? Does it have to do with the provider? Obviously, none of us who are attending this talk want to look like that anytime soon or ever.
Yes.
So, like, how do you get to look like that? Because I know none of us want to go that route.
I think that's a very good question. And I think that I would say a lot of times it has to do in the geographic location in the US where certain looks are sort of like appropriate or tolerated. I guess some people are, you look around and everybody has those pumped up big lips. It doesn't mean that's my approach to treating a patient, but you can see a patient coming from a certain part of the country, they're more likely to look a certain way from cosmetic procedures, or maybe a little bit more, if you think about natural, a little bit mildly enhanced to moderately to severely enhanced, beyond natural, It's a very good question because it's really an art form of trying to figure out taking the patient that's in front of you and taking their concerns. So not only they may be worried about one thing, but you think that they would benefit from another thing. So it's actually putting those things together, but at the same time, taking what they look like and trying to enhance it in such a way that it only complements them, not overdoes it. So I think that's kind of the crux of it. I think you have to go to the provider that is not only conservative, but also will not let you go too far. Because some patients, they will come in and they will say, I want that extra shot and, give me more filler. And you're like, no, it's too much already. It's like, no, you gotta be able to tell them no. And I think that's where I think maybe, and again, no judgment. And sometimes it can happen that it can look normal just by accident. I don't know. Maybe it was a reaction. Maybe it just overfilled. Maybe sometimes things happen again. But I think on average, you definitely want to go to a provider that is, and how do you know that, right? Because a lot of times we can't post those pictures because patients don't want their before and afters posted. So over time, you can get some of those nice before and afters that the patients be like, oh, can you show me what this looks like? And I think it's both a good and a bad thing because it doesn't mean that every person is going to have the same results from that. So if I can show you that how one person had, the Restylane injected in their cheeks, but they're going to expect the same result in them because it would be unfair because their body's different and they respond differently to treatment. And so to try to answer your question in a more understandable way, I think that it's either too much injected by a provider in the wrong place. Like sometimes you can take one filler and you can break it up. One syringe of filler, you can break it up in certain areas. Somebody doesn't need too much and put it just in the right location. Maybe a little here, maybe a little here, maybe a little here, and maybe a little here. And then that's where you want to stop. Whereas putting like 3 or 4 syringes, and sometimes we do put 2 or 3 syringes at a time because if somebody's never had anything done and they're very, very, very like depleted here, just because the number of syringes is not always what kind of makes it or breaks whether somebody's going to look fake. It's the location, how much of it, if it's already too much, if they already built up and they keep wanting more, and using it for the wrong thing. So it's trying to like, somebody's trying to help with the jowls, but they already filled in the cheeks. You don't keep filling the cheeks to try to lift the jowls. It's gotta be doing something else. Maybe ultrasound or radio frequency device. Maybe using Botox and fillers are not the wrong modality for that patient for that concern in particular. I think, and also I think a lot of times it's just greediness. You just want to take somebody's, money, just like, oh, we'll just keep inject this and this and this. So I think that's kind of the answer. I think it's too much, wrong placement, and sometimes it can happen. And the good thing is a lot of this stuff is temporary. So most of the fillers we can dissolve, which rarely is request because people just want more. And the neuromodulators usually go away in about 2 to 3 months. But that's where people kind of find like, I don't want to have too much like a frozen look, and that is also kind of playing with the anatomy and how much hooding somebody has. If somebody wants to get rid of the lines here, but they have already a lot of hooding, you have to kind of sometimes balance where it's more important to you having more open eyes and getting rid of every single line in your forehead. So it's definitely kind of a conversation between the provider and the patient, and also looking at the anatomy and seeing how much needs to be used. Yeah, definitely, you're right. It's a tough question to answer, but I think it's just kind of taking it all together and going to the person you trust. And
I love what you said, and I guess the answer is that you need to know when to stop, right? Like I feel like a cosmetologist, just like tattoos, you start with one and all of a sudden you just want to tattoo your whole body, but maybe it's the same thing with cosmetology. Yeah,
and I think and that's also, you need to know where to stop and you need to know when to use another modality, because Botox and fillers I think fillers is where people feel the most disfigured because it adds volume in the wrong places potentially, and so it may go beyond their natural anatomy, and that's where it starts to look a little funky. And then plastic surgery is where, I guess, if it's too tight, if the plastics, like the facelifts too tight, then it'll look a little weird, like
Yeah, yeah.
that's, or plastic surgery, the eyes can be different, somebody's nose. I mean, that's why it's called plastic surgery, kind of like, plastic. Yeah, so that definitely has a risk of looking different. With Botox or Dysport, there is a possible risk of looking a little different. Like you can have the squawk brows. So there's, things that you watch out for, or maybe too much heaviness in the forehead that can happen. But that again, that is temporary if that happens. And a lot of times we can add a little bit more to bring them down, especially if it's the first time somebody comes in. So we always say the first time you ever get a neuromodulator like Dysport, I use Dysport a lot. I really like it. After about 2 weeks, I have the patient come back, and if it's their first treatment, we say, let's see. I always put more. I'd rather put less now and see if that works for you. And we can always add. And if we don't need to add, great. If we need to add, we say, okay, great. So the next time we'll just add those extra units to the treatment plan in about 3 to 4 months.
Well, I have to say, I feel that anyone in your hands, Dr. Kovetz, will be safe and beautiful. So I'm so happy that you're coming to community chats, and we have, it's really like a gift to be able to count on your expertise. So thank you so much. And to all of our attendees, thank you. I see some comments here that thank you so much. Great presentation. And that certainly there are some rough practitioners out there that are not even licensed, and they are doing things that they're not supposed to, and unregulated is fast. So definitely. But well, thank you so much. I know you'll be back because everybody loves your talks, and we all love about learning about all these things. And now, don't be buying cheap things, just do what you need to do and be good about it. And Dr. Kovetz, I'll talk to you again. Thank you so much for being with us today. And thank you for our attendees. Keep it coming. Next week, pedestrian safety. We're going to talk about what causes accidents out there on the streets and how we can help prevent them, if not for ourselves, for other people as well. So thank you, everyone, and I will see you next week. Dr. Kovetz, see you soon. Take care.